My name is Anusha Vable, and I'm a social epidemiologist and associate professor and affiliated faculty at the Philip R. Lee Institute for Health Policy Studies, the Department of Family and Community Medicine, and associate director of the Center for Health Equity. And I appreciate this opportunity to introduce myself to you. I identify and advocate for structural solutions to health inequities. In practice, I focus on socioeconomic exposures across the life course and healthy aging, with a particular focus on the education system and on cognitive health. Methodologically, I'll use anything available to answer my research questions, but I particularly have expertise in matching methods, the measurement of life course socioeconomic status, quantile regression, and sequence analysis, which is a powerful and underutilized method to characterize variables that unfold over time. Substantively, I've focused on the education system since my dissertation work. Some of my work has focused on the Korean War GI Bill, which subsidized college education for qualifying veterans. I found that GI Bill eligibility predicted smaller socioeconomic inequities and markers of mental, physical, and cognitive health among veterans compared to non-veterans. And we're now expanding our GI Bill work both methodologically and substantively. This substantive work helps inform my advocacy goals. Broadly, I believe the state of California is underinvesting in the public education system at three levels. First, ages 0 to 5. We know this time period is critical and we know it's a market failure. If it's a market failure, we need the government to fix this. They're the only ones who can. Two, K through 12 education has been underfunded for decades in California. We have an uneven and inequitable distribution of necessary services, such as buses, nurses, and guidance counselors, and have to fundraise for basic programming like arts and PE. Finally, at the college and university level, the state has also been underinvesting. College used to be free in the UC and CSU systems, but due to underfunding by the state, we're now squeezing students with ballooning tuition payments and squeezing low-wage workers with barely livable wages. This is why 48,000 academic workers went on strike last year. We know that education is the primary mechanism for economic opportunity and mobility in the country. Therefore, it's vital that we convince the state to properly fund the education system. I want to be clear that I'm not talking about a one-time investment, but a massive and systemic course correction. Thank you.